Yeah, great to have your company right here on DXB today. Hope you're staying safe. Hope you're staying well. And talking of well, you'll enjoy this one because this is our health care special. Health care continues regardless, rain or shine, and that is what we're seeing at present. Joining us now is none other than the Group Chief Information Officer of American Hospital right here in Dubai, Charles Onjo, who joins us now live on the sofa. Charles, good to see you. Really appreciate your time. Thanks so much indeed for being with us. We're just talking to Brian about, the fact that we are talking a lot about resilience across businesses at the moment, none more so than healthcare. The other phrase we're hearing time and time again is business as usual. Okay, it's business as usual, albeit in unusual times at present. When it comes to a hospital, a fully working, functioning 24/7 hospital, what's business as usual look like at the moment?
It's just, as you said, it's business as usual. You always find a hospital is kind of like, when you open the doors, it never closes, especially when you're doing secondary type emergency healthcare like we do. So it starts and it carries on. And all the teams, honestly, are there for really engaging how we deal with patients every day, no matter what it is. You find a special ethos, a special theme going on that is just literally business as usual. You walk in every day, the energy is still there. It's a little bit different, across the piece. A few more coffees now and again, but it's across the team. My team in technology, we're there 24 hours a day, 7 days a week, no matter what it does. So that's pretty much how it is across every team.
Quite right too, right?
But Charles, speaking of moving forward, you're saying you're doing a lot of big changes, right? A lot of big things happening. But what is American Hospital doing during these uncertain times to make sure that patient care is never disrupted?
Yeah, I mean, the big things that you hear a lot, and what we deal with a lot, is how do you deal with infrastructure, technology, and the building? And we keep looking at that every single day. We've got a lot of plans in place. Healthcare is a bit unique. It's kind of like you look at what happens when things don't go right all the time. So what happens if the emergency room gets a lot of people? We're planning for that all the time, no matter what time of the situation is that's going on. So across IT, we do that. So we plan for what happens in downtimes, etc. What happens when we get ramps, not ramps, slowdowns, different things all the time. What happens if we have a piece of equipment fail? We have things fail now and again in IT, networks and different things. So we have to plan for that all the time. So we keep planning for it. We keep looking at it and checking. The big things that you see, different parts of the times of year, up ramps in cybersecurity and different aspects like that. And that's what we look at.
So Charles, I know when we've had previous episodes of DXB Today and we've been talking about healthcare, we've been discussing how important technology is in the healthcare sector. So I'm really interested to know, how important is technology when it comes to keeping hospitals up and running, especially during these uncertain times?
In today's world, honestly, from being in healthcare tech now since the early 2000s, technology is it. You can't run healthcare without technology across everything, be it mobile devices right through to the big MRI scanners and things that we have. Data and imaging is critical. So electronic medical records nowadays are literally, how do you get the information to the right people at the right time? So it's absolutely critical to all operations in the hospital. The weirdest thing is you don't think about the simple things like door access controls or thermometers in fridges to detect whether the fridge is the right temperature. So all of that is all technology, and we have to keep going with it. It's a pretty interesting time.
What about people these days? Are sort of trends changed a little bit, especially when we were talking about the importance of telehealth, etc. And now it's so accessible through different things. Or are you still seeing people come through the door wanting face-to-face?
You get across different aspects. We're seeing different things across the organization, from some of the satellite clinics, higher ramp than different parts of the organization. Telemed, we just launched, before quite a few other people, a mental health phone call platform to help the community. We ramped that really quickly. We've just launched a new video telemed platform. That's ramping quickly across everything. But we're seeing people come to, they might not travel as far.
So communities.
To communities versus the whole, let's come from all around. They're going, now we've got multiple hospitals, more clinics. They're going to where they need the services. So you might not just come a long distance to where we are.
Interesting.
Charles, I got to ask, we've been talking about technology, we've been talking about infrastructure. Let's move a little bit to the human aspect of healthcare, right? How are you supporting your medical and non-medical staff at this time?
A lot of it is continue communicating with people, communicate with your team. There's a little uncertainty, people travel into the office from all over. Getting your team in, connecting with your team.
Absolutely.
Right, using tools to connect with the team, make sure they're all okay, support with them. I just think everybody does that, right? You genuinely do that as a team member and a leader, and all of the leadership's doing the same thing. Checking with everybody. We've been doing holding lunch dates, kind of like having lunch for the whole team, bringing people together. So all of that has been the most important thing. Just caring for the people internally as well as we're caring for the community. It's just the simple basics.
Maintaining that human connection, right?
Yeah. A lot of it is that human connection, doing daily stand-ups with your team, just to get the vibe of what's going on. People have different things they want to talk about, so you talk to them, you figure it out, and then move to the next bit.
Right. And Charles, I'm just curious because a lot of people look at a situation like now and they back away, but it's honestly a good opportunity in other perspectives. So, I mean, from your angle, how you're, I would say, viewing the situation, what are the greatest opportunities for you, the team, the hospital, right now?
So across everything that we're doing, IT-wise, we're doing this big transformation project, right? So across everything, we're trying to actually expedite things, move things forward. Mobile app technology, new networking technology in our building, new telemetry information. We had all these projects in flight. So we're trying to push them as fast as we can. Get the team members. We're finding it's a good time to hire some people. So we're hiring some people, bringing those in. We just hired a couple of people the last couple of days, bring those in to move different aspects across the organization. We're just trying to reposition different things. What is the most critical items for the organization that needs to get in front of what might come out of some of this, and how do we make that happen? So it's just honestly what's the right items that need to be done at the right time. That's how we look at it. It's an interesting aspect because we've been putting in a lot of new tech across the organization. And sometimes that gives us interesting opportunities to train people, retrain people, change what they're doing. So we can make some of those changes pretty quickly and then deliver it. So it's pretty good.
So Charles, for our viewers at home, what reassurance can you give them about the healthcare services here in Dubai and that they're still stable and going on ahead as usual?
I think honestly, I see it every day. I think you guys probably do if you go past the hospital. We're there every day, right? There's nobody going anywhere. We're delivering full services across everything we do. We just look at every single thing every day and making sure we're adjusting as needed. Supply chain is a huge deal. We're keeping in touch with all of that. Technology, obviously, that I head up, I look at that every day and just keep actually changing the dial. Work with our partners a lot. Yeah, and I think the most amazing thing is in the UAE and across the region, the ecosystem is very huge and it's very loyal to each other, and we can pick up the phone and talk to people very easily, and you can get the vibe of what's going on, and people are more willing actually to help now than I've seen in a long time. You always see, sometimes best things come out of what you might not think, and so we're seeing that across everybody. We've got to keep our telecoms up. We've got to keep our infrastructure up. The hospital has to keep that. People keep having to turn up. I think that's solid. I've got colleagues down in Abu Dhabi. They're saying the same thing. It's just honestly, I think it's probably one of the best places to be.
It's amazing how the community comes together as well, and it's that willingness to learn from situations like this, isn't it? So can we make the assumption that the healthcare landscape will come back stronger after this because of the learnings we've heard, because of logistics, supply chain and otherwise?
I think so. We're actually seeing it in some of our clinics, actually stronger right now than we did before.
Wow.
Yeah, actually increases, right? So you find that people are doing other things that you think the ramp would be slower, but it's actually ramping faster.
Yeah.
So you're actually seeing that sort of upsell of where we are and uplift of what we're going on. I think it's going to be really good. Honestly, I've seen other places around the world. I don't think the focus is on it as much as here. Healthcare is one of the strategic pillars, right? And so when a community invests in that, that's a big deal. And I think across all of the investments you guys were talking about earlier, longevity, long term, you look at what's being built, what's happening, you don't just stop that in healthcare, right? So that's going to carry on. We're becoming a big sector in the Middle East and in the world for doing cosmetics and other things. I think that's going to come back as well. I mean, we're renowned for doing some of this, so yeah, it's pretty cool.